everybody. Dr. Neeraj Jain is a name known in quality. He is a lab director with Jain Diagnostics and Global Diagnostic Laboratory. He has done his MBBS and MD both from Delhi University and has been practicing pathology since last 25 years. He is an ISO 15189 technical assessor and has conducted around 26 internal editorial programs as senior faculty. He is the secretary of APP Delhi NCR. Dr. Neeraj Jain, welcome.
Thanks, Dr. Subodh Gupta, for your kind words. Laboratory medicine has assumed a central place in any healthcare organization. Daily we are reporting so many cases. What we are creating? We are creating some numbers or some information, and through our interpretation, that's it. And through our interpretation, we are converting these numbers into meaningful information, and then this information is applied in a particular clinical situation for better patient outcome. And when we plan for quality, although we are in this laboratory business for so many years, initially we think, or when we go for accreditation, we think this will increase our business, this will increase our confidence, this will decrease on our cost as well as decrease in the stress. But initially we don't find any increase in the business. Our cost also increases. We loses confidence initially. We are working in the laboratory for so many years, and now there are so many new issues we don't know anything about them, and it increases stress also. Although 70% medical decisions are based on our reports, but still we don't find there is any regulation over the pathological laboratories. And when this clinician, they get good diagnosis from our laboratory, they are very happy. They think their experience is just like heaven, although we don't make anybody Swargwasi in our lab. And when they don't get good diagnosis, patients or doctors all think their experience is just like hell. And this microscopy has always fascinated everybody. Everybody wants to look into the microscope, what these pathologists are seeing in the microscope. And we find changes everywhere. Initially there were black and white movies, then colored movies. Similarly, in the laboratory also, we find changes over the last 50 years. Initially, a lab equipped with all these things used to be called as good equipped laboratory. And people used to say, my laboratory is good laboratory because it is run by me and I am MRCP or qualified from the America, therefore my laboratory is good laboratory. Then, as there were changes everywhere, in the laboratory also, there were people started adding new equipment. Although there was not much automation, no sophisticated quality control, people used to say then with automation, I have spent a lot of money in my laboratory, therefore my laboratory is good laboratory. Or my laboratory is the biggest hospital of the city, therefore my laboratory is good laboratory. But